Imagine walking into a pharmacy and the life-saving medication you need is just gone. No stock, no alternatives, just an empty shelf. Sounds scary, right? Well, this could soon be a reality in Ghana. Hello everyone, welcome back to Better Health with Dr. Payne. Better Health Start here. Today, we need to talk about something very serious. Ghana is at risk of losing access to essential medications because of a massive funding gap. The US government, through USAID, has been funding Ghana over the years by helping to provide medications for HIV, malaria, TB, and more. But now, that funding is running out, and we are looking at a shortfall of over 156 million US dollars. What does that mean for you, hospitals, and pharmacies? Let's break it down. You might have heard of USAID, United States Agency for International Development. But did you know they have been funding Ghana for decades? Let's talk a bit about how all this started. USAID was established in 1961 by President John F. Kennedy to support global development. And in Ghana, they played a major role in areas such as healthcare, education, and most importantly, USAID has been a major player in Ghana's healthcare system for decades. They have funded everything from malaria prevention to antiretroviral medications for those living with HIV, and their contributions have saved countless lives. But here is the issue. Funding doesn't last forever. Over time, donor countries expect local governments to take over these programs. Ghana was supposed to gradually increase their own investment in healthcare, but due to economic struggles, we have not been able to keep up. Now, with USAID pulling back, we now have to fill this funding gap. Let's talk about what medications could be affected. Firstly, HIV treatment. Over 260,000 people in Ghana rely on antiretroviral therapy, and without USAID support, access to these life-saving medications could be disrupted. Secondly, malaria medications and mosquito nets. Ghana has made huge progress in fighting malaria, but with this funding being cut short, this progress could be at risk. Thirdly, tuberculosis or TB treatment. TB remains a major health threat, and without consistent medication supply, we could be at risk of outbreaks. We also have family planning and maternal health drugs. Many women rely on USAID-supported programs for reproductive health services, including contraceptives and prenatal care. The loss of funding doesn't just mean fewer medications, it means more hospital overcrowding, increased disease transmission, and higher death rates. Patients who rely on free or subsidized medications will now have to pay out of their pockets. And let's be honest, not everyone can afford that. Health workers will be under more pressure, and hospitals may struggle to keep up with demand. And if we can't secure alternative funding, Ghana's healthcare sector could have a major hit. So, what can be done? President John Dramani Mahama this week called on the Finance Minister, Dr. Cassiel Attoforsen, to urgently address the resulting $156 million funding gap. The President expressed deep concern over the 78.2 million US dollars shortfall, which threatens critical healthcare interventions. This means that the Ghanaian government is in discussion with USAID and other partners to find solutions. But time is running out, and we need clear policies and increased funding, and possibly new partnerships to ensure people continue receiving care. Well, this is a wake-up call. And as stated in Ecclesiastes chapter 7 verse 12, wisdom is a shelter, as money is a shelter. But the advantage of knowledge is this: wisdom preserves those who have it. We often take healthcare access for granted until it's gone. This verse highlights the importance of wise financial decisions and how money can be a form of protection, just as healthcare protects lives. Ghana has come a long way in improving public health care, but without sustainable funding, we risk undoing all that progress. Let me know what you think in the comments. How should Ghana handle this crisis? Should we rely on more external funding, or is it time for Ghana to take full responsibility for its healthcare system? Thanks for watching. This is Better Health with Dr. Payne. Better Health starts here. Don't forget to like, share, and subscribe to this channel so more people can understand what is happening. See you in our next video, and it's ciao!